Hello. In today's video, we're going to talk about techniques for increasing penis diameter. If you want to learn a bit about these techniques, stay tuned with me until the end, because in this video, I'll cover everything you need to know. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health, and now let's move on to the video. It's very important to mention that penile enlargement and penile thickening are very common demands in urologist offices, and until recently, patients who complained about having a small penis or a very thin penis were marginalized. Urologists often neglected these complaints, attributing them to psychiatric issues, dismissing the patient's concerns about having a diminished penis. Consequently, many urologists didn't give this matter the proper attention it deserved. This led patients with such complaints to seek help from unqualified professionals in male genitalia, even though in most cases, these individuals had a normal penis. However, he carries with him the complaint that the penis is small, the penis is very thin, and he is really not satisfied with the size of the penis, and that's where those catastrophes occurred, those silicone injections, autologous fat, polymethyl methacrylate, better known as PMMA. All of this happened in the past. And worse, it still occurs even today, and the majority of patients after such a procedure are not satisfied. There are atrocities. There is a migration of this product to regions of the foreskin or to the base of the penis. These procedures have never been recommended by medical societies, and especially urology societies worldwide. So the first tip is, do not apply substances to the penis that are not absorbed. Examples like PMMA, silicone. These substances, after being placed on the penis, they cannot be removed, or if they are removed, it requires major surgery on the patient, and he can lose a large part of the skin and the penile shaft, so it is not recommended to put silicone or PMMA or any other substance. Also avoid putting autologous fat, which involves taking fat from one part of the body and placing it there in the region of the penile shaft. Its consistency becomes somewhat softened. The patient still runs a risk of having a fat embolism, and the patient dies, has a sudden death. So this type of treatment is not recommended. The second tip for those who wish to undergo penile thickening is to use hyaluronic acid. As it is a substance already produced by our bodies, it has low rates of complications, and it has been widely used by plastic surgeons, dermatologists, especially in facial fillers. In the last 10 years, hyaluronic acid has been used with the goal of thickening the penis because hyaluronic acid has the ability to absorb water, so there is an increase in volume in the region, and it is absorbed more slowly in the penis due to its concentration. On average, 90% of the product is found in the penis after a period of 2 years, so perhaps in 2 to 3 years, the patient only needs a touch-up of this hyaluronic acid. And if the final result is not satisfactory, the professional can apply hyaluronidase, which absorbs this hyaluronic acid, and the penis returns to its normal size. This may indeed be a safe technique, which is a reversible form, not a permanent one. It is like putting in a penile prosthesis. After putting in a penile prosthesis, there is no way to remove it, and the patient returns to having an erection, so it has to be discussed with the patient, explaining all these situations. And the third tip, for those men who want to undergo penile thickening with hyaluronic acid, is to undergo this procedure with a certified urologist using a patented technique called UroFill. This technique was developed by an American urologist named Paul Perito, who has nearly 9 years of experience in its application. It is a staged technique where the hyaluronic acid is slowly injected and the urologist molds the filling. It has a high satisfaction rate and a low complication rate. So this type of procedure is a revolution in genital aesthetics. So those are the 3 tips. Avoid injecting permanent products. The second tip is to use hyaluronic acid. And the third tip is to try to undergo this type of procedure with a patented technique, which can offer better safety for the patients. Well, I hope you enjoyed the video. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.